Anaphylaxis. So today we're gonna discuss about anaphylaxis. Anaphylaxis is an emergency life-threatening allergy condition triggered by allergens like foods, insect stings, medications, or latex. Can affect the skin. So it can affect many parts of our body, like the skin, mucous membrane, lungs, the gastrointestinal tract, and the heart. So so these are the main symptoms: itching, hives, flashing, throat tingling, or like tightness. So there may be swelling in the lips and tongues and the throat. So nausea and vomiting and diarrhea are other key possible symptoms. Can also cause abdominal pain and the abdomen and wheezing and shortness of breath with trouble breathing in the respiratory tract. So and palpitation, dizziness and low blood pressure with cardiac arrest are possible consequences. So 10 to 20% of kids do not have hives. So it can either occur all at once, which is called in phasic case, where once so the symptoms are treated, they won't happen again, or it may come after symptoms are resolved, in which case we call it biphasic anaphylaxis. So it may last like for a few days to weeks. The most common type is genophasic, and symptoms develop in 30 to 60 minutes time. So anaphylactic shock is another manifestation of anaphylaxis. As we form, we can have low or normal blood pressure and still be severe anaphylaxis. So to say severe anaphylaxis, we don't need to have a very low blood pressure. It may be low or normal, because there are other severity signs. Anaphylaxis and anaphylactic shock are both severe illnesses that can be fatal, require epinephrine. So the risk factors for severe anaphylaxis include, so, being older than 65, like history of macrocytosis, which is in the blood, in the body there will be a build-up of mast cells. So taking certain medications, other health problems like heart lung disease, have food allergy. So the anaphylaxis triggers like foods, as I mentioned before, foods like milk, eggs, wheat, soy, tree nuts, peanuts, so shellfish, finfish, and venoms like from bees, fire ants, and snakes. So, and medications. The most common offending anaphylactic medicines include penicillin, cephalosporin, sulfonamides, and aspirin, and non-steroidal anti-inflammatory drugs. Latex is also known, and other unknown triggers are there also. So the other is anaphylaxis treatment. So epinephrine has to be started as soon as possible, and injection, or it can be given in the form of an injection or a nasal spray. So bronchodilators like albuterol for breathing, and other list of treatments include like antihistamines, fluids for low blood pressure, oxygen as needed, intubation for airway control, or CPR for cardiac arrest. Just to be done. Okay, that's all. Thanks for watching.